I'd like to call the Wednesday, November 25th, 2020 Papillion Board of Health to order. Ms. Brown, would you please take the roll?
David Black, Scott Lyons, Bob Stubbe, Bill Bose, Jeff Strohmeyer.
Would you please join me in the Pledge of Allegiance? Pledge allegiance to the flag of the United States of America and to the republic for which it stands, one nation, under God, indivisible, liberty and justice for all. Thank you. And do we have an affidavit of publication on file?
We do.
And a current copy of the Open Meetings Act is posted in the back of the council chambers. First item is an approval of the agenda as presented. Do we have a motion to approve the agenda? Motion by Stubbe. Do we have a second? Second by Bose. Any discussion? Please vote. Motion passes. Next is item C1. It's a discussion item. And I'll just kind of kick it off. The discussion is Ordinance 1911, an ordinance to amend Papillion Municipal Code Chapter 125 entitled Health and Sanitation to add new sections 125-11 through 125-23 to enact requirements for the wearing of facial coverings under certain circumstances so as to abate the COVID-19 pandemic and to provide for an effective date. Typically in city council, we get a motion on the floor and a second before we have discussion. In this one, we're actually having discussion first, and that's the way the agenda was published because it's the discussion that's going to inform whether we want a motion or not. And so just want to open it up for discussion. I want to do a couple of items to set the stage. Sarah Schramm is joining us online, and she is the Sarpy Cass Health Director. So I'll ask her to fill in from the Board of Health, the Health Department's perspective, and then we'll just open it up for open discussion. And then once we have open discussion of the Board of Health, if there is a motion and a second, then we'll ask for proponents and opponents, and that'll be an opportunity for the public to speak. And then procedurally, the Board of Health is an unusual board, and I think it actually came out of the whole smallpox situation so it got into state law, I think in the 50s. And the Papillion Board of Health has not met during my term, so at least it's been 12 years since this body has met, but we have kept it up. By our ordinances and by law, the Board of Health is the mayor, the city council president, which is Bob Stubbe. It's the quarantine officer, which we actually have, which again comes out of the concept of pandemics, and that happens to be the chief of police. And then a city physician, which that's an appointed position, that's Dr. Strohmeyer, and then one appointed official. And since we're dealing with health, the appointed official has always been our fire chief, Chief Bose. So that's the Board of Health. It's kind of the background of it. So discussion, I'm going to have it up on the slide. I don't know if Sarah can see it, but she'll be familiar with it. The Sarpy Cass Health Department puts up a dashboard, and it's open to the public. If the public wants to see it, it's updated once a day. If you go to sarpy.com and then go to the Board of Health, and they have a dashboard on there, and you can click that, and it's got a lot of good data you can drill into, a lot of demographics. But the first one I've got up here, this is a hospital perspective. So this is just the Omaha Metro Hospital. So this is not just Midlands, this is the Omaha Metro area, hospitals and ventilators. And you can see by date the progression of how many COVIDs are in the hospital. The vents is the dark line at the very bottom, but the hospital is the escalating line. So that's one item I just wanted to show for a little bit of a perspective. The next one I want to show is age groups. I think if people aren't following what the perception is, it's just the old people getting COVID and young don't have to deal with it. Most of the COVID actually is in the 20 to 50-year-old range. The deaths are in the higher range, but the number of active cases, and this is current active cases in Sarpy County is what you're seeing, is in the 20 to 60-year-old group. I won't speculate of why that's occurring, but it's an active group, going to bars, having informal gatherings and that type of thing. There's another chart that says, are people getting it from direct contact or just general spread in the community where you may not be able to trace it back to a certain source? And I think it's a vast majority, I think, is community spread. About, I think, a third, if I remember right, is direct contact. The next one I want to show is a summary of, so this chart of age is all of Sarpy County. I want to show Papillion, and when I say Papillion, and this is my chart, but I pulled the data from the SarpyCast dashboard. On the SarpyCast dashboard, they actually break it down by zip code. And they do a lot of other breakdowns too, but I just pulled 68046 and 68133 because that's kind of traditional Papillion, to put it into context of what's going on with Sarpy. And this was the dashboard from Monday. So this is 2 days old. You can see Papillion core 68046 and 133 made up about 27.5% of the active COVID cases in Sarpy County. But then I broke it down again by that age group, and it followed the same. You can see it's really that 40 to 60 age group that's the peak for Papillion, followed by the 30s and the 60s. So again, core Papillion kind of follows what's going on with Sarpy. The last thing I want to share is a calendar that I put together just to kind of get my own head around what's going on. We hear about 10-day quarantines. We hear about 14-day incubations. And the thing I wanted to look at was the incubation. So you come in contact with somebody who is COVID positive. How long will it take to show up? And at least from what I understand, that's the 14 days. It takes up to 14 days to incubate. And so what I looked at is we're coming up to Thanksgiving tomorrow. That's going to be natural gathering. So to me, that was kind of a day zero event. So 14 days past then, we're going to deal with the ramifications of Thanksgiving, family gatherings, and those types of things. Then we've got Christmas Eve, another day zero event for another 14-day incubation. Then we got Christmas Day. Then we got New Year's Eve, and then we got New Year's Day. I just wanted in my own mind see how these layer together, the 14 days on a calendar. And what you can kind of see is the reds on here are the day zeros, Christmas Eve, Thanksgiving, New Year's Eve, that type of thing. And then the brown, the 1 through 14, I'm just counting up the 14-day incubation. What you can see then is really January 1st, the week of January 1st, all 4 of those incubation periods are alive at some level. And then the second week of January, there's 2 of them still alive. So if we continue with those hospital increases that we saw on the dashboard, if we see a lot of ifs, if we see the day zero events and the incubations increase some, it looks like the hot spot in my uneducated non-medical mind is probably that first half of January is really what we're got to be thinking about and worrying about, and encouraging people with or without mandates to do all of the right things. So I just wanted to share those things for a little bit of a ground level. I'm going to open it up to Sarah, have Sarah share her perspective as the director of the SarpyCast Health Department. And again, this structure is set up by state law. We are under the SarpyCast Health Department, so they can give directives, and if they're approved by the state, we actually follow those. So Sarah is an authority that we are under. So Sarah.
Good morning, everyone. Thank you for having me with you this morning to give you a little bit more of an update. Mayor Black, you did a phenomenal job of walking through the dashboard and hitting some high notes. I'll take what you started and maybe go one step further. You started with hospitalizations. I would just let the board know that Sarpy and Cass County are part of the Omaha Metro Healthcare Coalition, which also includes Douglas, Saunders, Dodge, and Washington counties. So this healthcare coalition is a group of healthcare systems and response organizations such as EMS, emergency management, public health, that works collaboratively in our defined geographic areas to prepare for disasters and emergencies. So every day, the Omaha Metro Healthcare Coalition reports out to public health, as well as to those community partners, sort of the state of affairs within our Omaha Metro healthcare system. So as of yesterday, so I don't have today's data yet, it's a little too early for that, but as of yesterday, we were up to 438 inpatients diagnosed with COVID-19, and 24% of those, or 106, were receiving adult ICU level care. We had 48 individuals that were confirmed COVID patients on ventilators. Now we have 428 total ventilators available as of yesterday. So those COVID patients were actually using about 11.2% of our resources. But so remember that number 48, because what I've been looking at a lot at the health department is basically the last 4 weeks. So if we look at the MMWR week that ended October 17th versus our MMWR week that ended the 14th of November, in those past 4 weeks, the positivity rate for the Sarpy-Cass Health Department jurisdiction doubled from 15.25 to 32%. Over that same period of time, our 7-day rolling average for the weeks went from 41.6 cases per 100,000 residents to 96.9 cases per 100,000 residents. In October 17th, the week ending October 17th, there were 137 COVID positive patients in the hospital. That was the weekly average. In that same time period, the week ending November 14th, we were up to 378. And as I just mentioned, we were up even further. As of yesterday, we were at 438. When we look at ventilator usage back in October, that week ending the 17th, there were only 10 COVID positive patients that were on ventilators. For that week ending November 14th, we were up to 44. You did a phenomenal job of hitting the high notes on 68046 as well as 68133. I would just say from a 30,000 foot view, as of yesterday afternoon, there were 10,393 residents in Sarpy County that had tested positive for COVID-19, which represents about 5.5% of our population. That's kind of where I'm seeing things are at. We're doing a lot with monitoring our hospitalization data. If you listen to when the governor speaks, he speaks a lot about hospital capacity and what these next phase of potential restrictions may be if we would reach a 25% capacity level. For the state, yesterday, their dashboard was a day behind. I know they were having some technical issues. So for 11/23, the state's dashboard was showing 971 inpatients diagnosed with COVID-19, which represents 23.4% of our staffed beds available in the state. So we are inching closer and closer to that 25% threshold where additional restrictions with increased limiting on gatherings, some masking in certain businesses would be maintained. We're getting closer and closer to that every day. So that's kind of what I have for this morning, Mayor Black.
I want to put you on the spot and ask a couple of questions, and we'll
Yeah.
open it for the discussion, but just some things that have been asked of me. One would be Omaha and Lincoln have put in a mask mandate. The surrounding cities had not until recently. They're starting to trickle in. And depending on the data you look at, there may or may not be a material difference between Omaha and the area, the outlying metro that does not have a mask mandate. So obvious question is, do mask mandates even work? Could you respond to that, Sarah?
Yeah, so I think, you ask the question that public health deals with all the time. How do you show and visualize what is prevented? And that's the goal of public health, right? To promote and protect the public's health. And so when you think about Omaha and Lincoln and the cases, people will say, well, the cases they're still having cases. And I think the important thing to remember with non-pharmaceutical interventions is that it's not just one thing. Wearing a mask will not make cases go away. It is the culmination of multiple strategies. It's masking, it's social distancing, it's staying home when you're sick, it's avoiding crowded spaces, close contact. It's the culmination of all those interventions that lead to reductions in cases. And I always, think, what would Douglas County be like if they didn't have a mask mandate? And so I think it's important to remember that masking is not just one. The other thing to consider when you think about Omaha is Douglas and Sarpy County, we're transient by nature. We have individuals that are moving in and out of our communities at any given point, probably multiple times throughout the day. And so without having the same level of masking expectations or requirements around it. It's really kind of truly hard to tell exactly what that prevention could be, because we do know that people are going outside of Douglas County for multiple things, right? And people from Douglas County are coming into Sarpy at multiple points throughout the day as well too.
Second question that I've gotten is, and just to get your perspective, so for this to basically go away, we need the vaccine and people to get vaccinated, a certain amount of the population, and then a certain amount of population to have the antibody. And then once you've kind of hit that mass, then it is maybe kind of like the flu. But we don't have either one of those, which is why we're dealing with it. So the question that I've gotten is, does the mask mandate actually go counter to helping things? Because if we get the mask, we're preventing people from getting the COVID, which means we're preventing the antibodies. So while we think we're doing a good thing, are we actually delaying and doing a bad thing?
So I hear maybe you asking a little bit about herd immunity. Is that a fair statement, Mayor Black?
That would be it.
Okay, so I think when we think about herd immunity, essentially in public health, when we talk about herd immunity, it's about vaccination planning. It's about how many people have to, when we think about that vaccine, have, to your point, those antibodies to be able to sort of create an insulation, right, of those that are unable to get a vaccine. But when we talk about herd immunity in a novel illness like this, you're essentially basically saying that you're going to abandon any prevention strategies. And I think the thing to remember is this, especially now, we are at a point of cases where we are taxing, and there are multiple healthcare systems across the state that are at capacity, and those that are very near to capacity. And so to just abandon prevention is not what we want. And actually, there was a physician at UNMC that about 2 weeks ago, every Tuesday and Friday, there's about 200 healthcare system representatives, local public health departments, DHHS, the governor, healthcare coalition representatives that come together on a call. And the numbers were presented for the state of Nebraska based on current infection rates, case fatality rates. What would that look like in Nebraska? And it was actually 1.1 million cases in Nebraska, nearly 7,000 deaths, and over 23,000 hospitalizations would be the actual numbers if you ran it on what herd immunity would look like in Nebraska. And that would overrun our healthcare systems. We would have no feasible way to respond to that. So it's about how do we implement mitigation strategies to slow things down so that hospital capacity can maintain and stay robust enough to support those individuals that are sick with COVID, but also those individuals that are still having heart attacks, strokes, all of those other things, while we continue to work on the vaccine to get that in place. And so it's kind of, we're trying to kind of juggle all of these things at once so that we can maintain this level of support and health for the entire population and just not let something, burn through the community and then results in, catastrophic. I can't even imagine 7,000 deaths of Nebraskans to this and over 1.1 million infections and nearly 24,000 hospitalizations.
Thank you. And one other thing, just for the public, how the Board of Health got to this meeting is the City Council has a committee structure where items that need some input can go to a committee. And so the question of a mandate did go to the City Council Public Safety Committee late last week. And that's 4 city council members. Mr. Stubbe is not one of those. And so they had active discussion of the validity of a mandate and what do we do with it. And it was that public safety committee that made a motion to call the Board of Health to consider the mask mandate. So that's where it came from. And that came on a 3-1 vote. 3 for a mandate. I mean, 3 to call the Board of Health, 1 not to. And I don't want to represent the nay, but I think from the discussion, it was from probably a personal rights perspective. Does government have the right to mandate? People just need to do the right thing, and perception is people are wearing masks. So I think that was the no vote, and then the other 3 were call the Board of Health and get the ball rolling for a mask mandate. With that, I'm going to open it up for discussion. Mr. Stubbe.
Yeah, so thank you, Mayor. A couple things. One would be with regard to, you talk about the Board of Health, and I've been a city council member since 2008, and we've never done this before. And I'd like maybe for either the mayor or city legal to talk a little bit about why we're here today. And part of it comes down to the fact that I think there was a state senator that indicated, in his opinion, state law allows for cities to do what they're doing. And I think that's part of the reason why you're seeing somewhat of that domino effect by other communities out there that are taking the initiative to do that. And so before I do that, I want to talk a little bit with the police chief relative to what we can do today without a city mandate. And so talk a little bit to us, chief, with regard to, there's a lot of businesses out there. So if I go to the grocery store, if I go to the hardware store, wherever it might be, they've already got policies in place, not only to protect their employees, but to protect the citizens that are coming in the door. So if a business has a policy today with regard to mandating a mask, what ability, if they call into police, what ability do you have relative to enforcing that particular request for service?
Push the talk button. Bottom right.
Oh, there we go. Okay, sorry. I'm not used to sitting in a seat like this. Currently, if a business called in regards to somebody inside there, they have the right to issue that person a warning to leave the property. And if they do not, then they could be arrested for trespass. And so that would be the mechanism that the police would respond. And that's the tool that would be utilizing in that instance. And so our officers practice community-oriented policing, and so we do a lot on the front side trying to educate and trying to get voluntary compliance, but ultimately they would have to fall back on the authority of an arrest under trespass.
To kind of expand on that, currently without a mask mandate, the police department can cite somebody. Now talk to me a little bit about if the city of Papillion would have a policy, which we do, relative to somebody going to the landing or somebody going to the library or something like that, that would be considered public property. What authority do you have in that particular situation if a citizen comes in and says, I'm not going to comply with your policy relative to a mask mandate?
We would have none because it is public property at that point.
So to me, I think that's an important point when we talk a little bit about having a mandate, is that obviously police have the ability today without a mandate to issue a citation. But when it comes to public property, which I would assume that schools would probably fall into that same category as being public property, there is a little bit of an issue with regard to whether you can actually do anything. And I think that's an important point that I'd like to make anyway, relative to a mask mandate. Mayor, if you would also talk a little bit about what the Board of Health Authority is, because I guess I've looked at the state law and I might have a little bit of a different opinion relative to what our authority. I believe that the Board of Health has the ability to enact law, but I think there's also some question relative to whether it should go to City Council for consideration.
Let me do a quick layman's and then we'll ask Carla to fill in from a legal perspective if I'm wrong. A fundamental understanding of Nebraska and how it operates is really important in this whole discussion. I think there's a perception that local control exists in Nebraska. That is absolutely not true. Most states have what's called home rule, which means that a local jurisdiction can do anything it wants to do unless the state legislative body has said it can't. Nebraska flips that logic. A local municipality can do nothing unless the state legislature has given it permission. It's a concept of, it's called enabling legislation. Everything we do, we have to be able to point to a piece of state legislation where the unicameral gave us permission to do what we're doing. The concept, it came out of a Supreme Court case in the late 1800s. And that's how states determine, it's called, are you a Dillon state or a home rule state? And so in Nebraska, we're a Dillon state. We can only do what the legislature gives us permission to do. And the logic, I believe, comes out of, a city is a creation of the state. A city is technically a corporation, and it's the state that sets up corporation laws. So as a result, we are a creation of the state, so they get to tell us what to do. That's the general theory. So the question then becomes, if we want to do a mandate, what's our enabling legislation, and does the legislature give us permission? That's where it gets a little muddy. There are some jurisdictions around Nebraska, their state attorneys have looked at state law and said, I don't believe the local municipality has the authority to pass mandate. It has to come from the government. And there's others that have made the interpretation, and Papillions has made this interpretation that yes, we do have the authority to pass these. But early on, before the huge spike, because there was that mix, at least in Sarpy County, we've got 5 cities in a really small county. The mayors of the 5 cities and the county commission were basically saying, we can't have a patchwork. That creates confusion in the public. Half the people don't even know when you move from Papillion to La Vista or from Papillion to an SID. And if we do things differently, that's going to create confusion. And one of the worst things to do in a pandemic is have confusion. And so up to now, we've said we wanted uniformity. And that's why we've been working really close with Sarah at the health department. But in order for Sarah, so we've been taking the lead of Sarah up to this point. But at the health department level, in order for the health department to pass any directive health measures, which she has the authority to do, the county directive health measures actually have to be approved by the state health department, which is under the executive branch, the governor. Starting to follow separation and branches of government here. And the governor has stated publicly he is not going to pass a statewide mandate. And so up to now, we've been staying uniform and following the lead of Sarah. Once the dramatic increase of hospitalizations and COVID started to occur over the last couple of weeks, I think that's where people started viewing things a little bit differently. And one of those is the state senator you mentioned. Senator Justin Wayne, is the chairman of the Urban Affairs Committee. And the Urban Affairs Committee of the legislature is the one that works with the laws the cities fall under. He has stated, and he is an attorney as well, he has stated from a state senator perspective and chairman of the Urban Affairs, he believes, and he cited all of the authority, that cities do have the authority to do what we do. So his interpretation matched what Papillion's legal opinion had been. And I think it's once he came out and said from the legislative perspective, he made an interpretation that started to align with what some of the other local jurisdictions are. That's when you started seeing some of the local jurisdictions last week starting to pass mandates. If I remember right, I think Kearney might have, Grand Island might have, few of the outstates did. And so that's why they started trickling in. And then Ralston did, and I think their idea is they're kind of a bubble in the middle of Omaha. Now that they believe they have the authority, they're going to. And they're one that, Ralston's one, I think actually changed their interpretation, their understanding based on what Senator Wayne did. And then once that started, then that just started the other discussions. Gretna City Council meeting, I think last week, their council sparked the discussion of we just need to pass one. And so Gretna then did pass it. La Vista, at their last city council meeting, the council said we need to look at passing it, and they actually had a board of health and a city council meeting yesterday, and they passed it. And so now at that point within Sarpy, the uniformity is gone, and now we just have to. And then our public safety committee met and said we need to look at it as well. So I don't know if that answered your question. And Carla, anything else to add to that?
All right, am I on now? Yes, Mayor, you are correct that the quick version of it is a city of the first class like Papillion can only do such things as what the state legislature has allowed us to do. And there is a state statute that suggests that a city of the first class like us could pass any kind of a rule or regulation to deal with an infectious disease. And that was the opinion that legal had given to the city early on in this. And as Mayor explained, there was a decision to kind of wait and see what happened because of the patchwork issue. Now, we have the authority under the state statute to do this, but we also have to look at our city ordinance. And under our city ordinance, it also allows us to do it. And that's why we're here with the Board of Health today, because the way our city ordinance is set up is it really indicates that that any kind of a rule dealing with an infectious disease would come from a recommendation of the Board of Health that would adopt a rule or regulation, which would then be adopted by the city council. So that's what will happen today. If the Board of Health decides that you want to have a mask mandate, you will pass that on to the city council, who will then determine whether or not to adopt it or not. If the Board of Health decides not to recommend to the city council a mask mandate, then the city council will possibly consider doing something like a resolution that would encourage that we follow all of the mitigation strategies, which would include the social distancing, the mask wearing, staying away from crowds, that type of thing. But the city council probably could not look at doing their own ordinance without a recommendation from the Board of Health.
I think a follow-up then too is you had asked earlier that there is a piece of state law that might suggest that the Board of Health can enact and the city council doesn't have to do anything. So we have full authority. And that's another one where I think depending on legal opinions at this individual cities levels, there's disagreement on that. But again, I'll ask Carla to.
And that would go back to what I was saying about our city ordinance indicates that it would have to come, that it would have to then go through the city council. Now, I did want to just address one other issue that Councilmember Stubbe in your discussion with Chief Lyons had made about the public property. Absolutely correct that private property, the police could go and they could issue a trespassing. A trespassing ticket actually is a little bit toothier than what a violation of the mask mandate would be. That would be a misdemeanor. Without looking directly right now at my books, I believe that it would be a 6-month in jail and $500 fine for a first offense trespassing. The penalty under this mask mandate would only be an infraction, which is lower than a misdemeanor, would only be a $25 fine. So for a business, depending on how serious they want it to be, they might want to look at a trespassing rather than a mask mandate. But the issue about the public property, Chief is correct that he would not be able to arrest somebody for trespassing on public property unless we had something posted. Somebody breaks into the library after hours, obviously, but that's not the situation you're talking about. However, I do want everybody to be aware that under this mask mandate, public property is exempted or accepted from the mask mandate. So a person who is seeking any kind of a government service, as we've got this right now, whether it's a federal, a state, a county, or a city service, is exempted, and city property would not be included in this mandate as it's written.
Mr. Stubbe.
Thank you, Mayor. So thank you for that clarification, because I think it's important for people to recognize is that it does have to go to City Council for consideration. It just can't happen here. But we can make a recommendation to the council, but it's got to be essentially voted on by them. I'd like to talk a little bit about our authority. If council agrees to do something like this, what the city's authority is, because currently we have the ability to extend beyond city limits relative to zoning and development and things like that. So I'd like to hear a little bit about discussion relative to where that boundary line is. And before you go into that discussion, I'd like to maybe clarify with the police chief also relative to the trespassing as it occurs outside of city limits. So I would believe that the Sarpy County Sheriff has the same authority if you have a business outside of city limits that you could call in to the sheriff and a citation could be issued in the same situation relative to trespassing.
Yes, you're correct.
The question on the zoning and the boundaries. So again, education for the public. We have the corporate limits of Papillion. So inside city limits is one boundary. And then the state gives us control of 2 miles beyond the city limits. That's called the ETJ, or extraterritorial jurisdiction. And then beyond the 2 miles, you're into pure county jurisdiction. And so within the city limits, the first ring, the full authority of the city, the planning, the building, the zoning, all of the ordinances we pass. If you're on the water system, inside, outside water rates, you're on the inside water rates. You get all city services, including police. And you also pay property tax to the city. The levy is on the property tax bill. So that's traditional city full authority. You move outside of corporate limits and you're in the 2 mile ring of the ETJ. At that point, you are outside of city limits. You do not pay property tax to the city. You do not receive all city services. If you want to go to the library, you buy a library card. The police do not patrol there. The sheriff patrols there. You're under the rural fire district instead of the city fire district. However, the legislature has said that is the city's future growth area. So from a planning zoning perspective, we do have full control and authority. And that then, as that 2 mile area develops, that's where the concept of the SIDs come in place. So if you hear about an SID, that is outside city limits. And so relative to this conversation, since this isn't what we're talking about is an ordinance of the city, it only applies to residents within city limits. So if we pass this, if the city council passes this, if the Board of Health recommends, it would not apply within the 2 mile zoning. That would be under county authority, under sheriff. And my understanding is that the county does not have broad ordinance authority. So the county may not be able to pass a mask mandate even if the cities do. So we are going to have this patchwork if this passes. Any other discussion? Be interesting to hear from a health perspective, Dr. Strohmeyer.
Yeah, I appreciate you having this meeting because our office is just overwhelmed right now with the number of calls and trying to take care of these people. I think the chart that you made was very telling that the ages 20 through 60 are those with the majority of the cases. And that's because above age 60, those people are scared to death. They're the ones that have the chronic illnesses. They're the ones using the mask. They're the ones that are staying home, social distancing from their families. That's why their incidence is so much lower. And that's what I think the rest of us have to accept a mask mandate, or, mandate's a strong word, but we really need to comply with what's recommended.
Chiefs, anything from your guys' perspective? Chief Lyons, if something passes, your department's the one that's going to have to deal with it. And I think it'd be interesting for people to understand maybe some of the dynamic of what's going on with Omaha about types of calls they get, because I think there is retaliation that goes on. Might be interesting for people to understand that ramification. A little bit about enforcement, and I know you've given a lot of thought, is this a wise thing to do or not? And then if it does, how would it be enforced? And then Chief Bose, maybe from your perspective, because you guys are the ones that have to transport people that are sick, so maybe a little bit of from a fire perspective as well. Chiefs.
Yeah, we've been, me and my command staff have reached out to the area law enforcement, and there's a lot of concern in regards to this issue and in regards to enforcement. And it can be encapsulated in several different things, but I'll try to do it really fast. Number one is the fact that you're putting police officers in a position where nationally we're being looked at for use of force incidents. And are we willing to sustain use of force incidents because someone won't wear a mask and the fine is only $25? It's a serious incident that any way you shape that. And once you start putting police officers in those positions, people could refuse, they could resist arrest, they could elevate those incidents, and that's of great concern to everybody in our communities. And so I think there's a lot of effort on law enforcement across this area and nationally that we use education, we use social media. We try to get out in front of these issues, try to engage people to get voluntary compliance. And then we work with businesses on such things as whether or not they want to prosecute in regards to trespass, because then you do have a situation where the fine is substantially more, it's a criminal offense, and it's also can be up to 6 months in jail. And so those are the types of issues that concern all of us, and I think the public would really want to consider that as well. The other thing is that these incidents that require a lot of time, energy, and trying to educate the public and get that compliance. And so it's not an immediate thing. It's a lot of energy that takes away from other resources within police departments. And so we're always dedicated to community-oriented policing, and our officers are up for that challenge, and we'll be pulling out everything we can to try to get ahead of that. But we do recognize that there's a large part of our community that already wears masks and is already engaged in this. And there's conversations going on regularly, and we see those all the time, even on social media.
Thanks. Chief Bose, anything to add?
Yeah, thank you, Mayor. 2 points I'd like to make. One, excuse me, one from a response perspective. If we go back, what seems like a lifetime now to February, it seems so long ago right now. February, March, when the country as a whole was gearing up for the pandemic, we were all changing policies and procedures and trying to protect people as best we could. We went through February, March, April, May, and into June without seeing any impact in this area. Yeah, there were some hospitalizations related to COVID, but from a response perspective, we weren't getting calls from people who were sick. Then in about the third week of June, we started seeing our known or highly suspected COVID patients. And much like the graph that you showed earlier, through the summer, it was a little steady incline. And then in the fall, it took off like a rocket. We see probably on average at least 6 or 7 COVID patients a day that we transport, which is a lot of sick people in our area. And we know that Midlands Hospital and Bergen Mercy, our 2 hospitals that we go to primarily, are almost overwhelmed with COVID patients. So there is a crisis going on right now. Related to that, the second point, one of the recommendations that we make if we decide to make a recommendation for a mask mandate to the city council is that it be enacted as quickly as possible. And my statement from our perspective would be, if we're going to do this, we should do it now. It shouldn't wait for the formal 3 readings, which I completely understand the purpose from a public safety perspective or a public knowledge perspective. But the crisis, the emergency is right now, so we need to deal with it right now.
Okay. Any other discussion from the board? Otherwise, we'll see if there's a motion. See no discussion. So the question is there a motion to approve Ordinance 1911? And again, Ordinance 1911 is an ordinance to amend Papillion Municipal Code Chapter 125 entitled Health and Sanitation to add new sections 125.11 through 125.23 to enact requirements for the wearing of facial coverings under certain circumstances so as to abate the COVID-19 pandemic and to provide for an effective date. Is there a motion? Mr. Stubbe.
Thank you, Mayor. So I'll just make a couple comments, and then I'm going to go ahead and move to support this. And so from my perspective is that I'm a strong believer in personal responsibility. And so there's no question that, we try to, as Chief O said, or Chief Lyons said, is you want individuals to comply. As the health director indicated, wearing masks is just one of the measures that, you can take to try to slow the spread of this. And so we look at the impact to the health professionals. We look at the impact to, the teachers and staff. And obviously I've got grandkids that go to school and I want them to continue to go to school. So I plan on supporting this, and hopefully we can get a positive support to take this to City Council for consideration. Thank you.
We have a motion on the floor. Do we have a second?
Second.
Second by Dr. Strohmeyer. Was that it? So we have a motion and a second. I'm going to go ahead and call for proponents and opponents for the public. I'm going to allow 3 minutes of discussion for each individual. I'll first call for proponents, anybody that wants to speak in favor. Once those are passed, I'll call for any opponents, anybody that wants to speak against. And then after that, if there's anybody that's kind of in a neutral position, we'll handle the neutrals after the opponents. And when you come up, if you would state your name for the record along with your address, so we have that for the minutes. And then I'll just say yesterday I received about 43 emails. 40 were for, 2 were against. I'll put that in perspective a little bit. I think there was a little bit of a campaign going in because a lot of them said the same type of thing. So I think some organization probably encouraged people, but I did try to vet, were they Papillion residents or were they coming from outside? And from what I could tell, the vast majority were Papillion residents, and it wasn't a form letter. So at least people were putting their own thoughts in there. But that's what I received yesterday. You have a letter in front of you from the Teachers Association in favor. Those will all become part of the record. And if this does pass and go to the city council, that will all become part of the record that goes to city council as well. Any proponents? Anybody want to speak in favor? See none. Any opponents? Anybody want to speak against? And if you'd state your name and address for the record. Welcome.
Sure. Hi, Lorene Renante, 1108 Park Drive in Papillion. I'll try to be quickly, since you're saying 3 minutes. I'll try to be like Doug Collins and talk as fast as I can.
And actually, since we didn't have any proponents, if you need a few more than 3 minutes, we'll go to 5.
Okay. So I was up all night, so bear with me, trying to get this prepared. I'm going to read a little something by this physician, surgeon, and editor of a medical journal. He says, if masks don't work, then why do surgeons wear them? Surgeons wear masks to serve as evidence that masks must work to prevent viral transmission is a logical fallacy. Although surgeons do wear masks to prevent their respiratory droplets from contaminating the surgical field and exposed internal tissues of surgical patients, that is about as far as the analogy extends. Obviously, surgeons cannot socially distance from their surgical patients unless they use robotic surgical devices. The COVID-19 pandemic is about viral transmission. Surgical and cloth masks do not prevent viral transmission. We should all realize by now that face masks have never been shown to prevent or protect against viral transmission, which is exactly why they have never been recommended for use during seasonal flu outbreaks, epidemics, or previous pandemics. If a surgeon were sick, especially with a viral viral infection, they would not perform surgery as they know the virus would not be stopped by their surgical mask. Unlike the public wearing masks in the community, surgeons work in sterile surgical suites equipped with heavy-duty air exchange systems that maintain positive pressures, exchange, and filter the room at a very high level and increase the oxygen content of the room air. These conditions limit the negative effects of masks on surgeons and operating room staff. And yet, despite these extreme climate control conditions, clinical studies demonstrate the negative effects, which is the lowering of the arterial oxygen and carbon dioxide rebreathing of surgical masks on the surgeon's physiology and performance. Surgeons and operating room personnel are well-trained, experienced, and meticulous about maintaining mask sterility. They wear fresh, sterile masks. They don't use masks, or they don their mask in a sterile fashion. They wear masks for short periods of time and change it out at the first sign of excessive moisture buildup, which degrades mask effectiveness and increase their negative effects. Surgeons never reuse surgical masks, nor do they ever wear cloth masks. The public is being told to wear masks for which they have not been trained in the proper techniques. As a result, they are mishandling, frequently touching, and constantly reusing masks in a way that increase contamination and are more likely than not to increase transmission of disease. Just go to the store and watch people at Walmart and tell me if you think the effectiveness of masks in the community are work. If you can't believe and trust the weak respective observational studies and confused public health authorities lying to you about the benefits and completely ignoring the risks of medical masks, then you should at least reject the illogical anti-science recommendation to block only 2 of the 3 ports of entry for viral diseases. Masks only cover the mouths and the nose. They do not cover the eyes. So that's not me that wrote that, but that is by a physician. His name is Dr. John Meehan. So my question then is how long are we prepared to wear masks? We were told in March that we needed 15 days to slow the spread. And here we are 8 to 9 months later, and health officials and political officials are still trying to scare us. Cities and states keep moving the target. They say it is only for a month, then 2 months, then forever. It's a slippery slope. Once you cross that line, you cannot go back. It cannot be undone. States like California and New York instituted a full shutdown and masks all around, yet the virus is still here. Masks clearly do not work. The numbers are going up. It is we as a small community do need to take a stand for liberty, because this is not going to stop. I'm not going to live in fear. I'm a 60-year-old woman, and I want to live my life and enjoy however long I have. People are advised not to travel, not to see friends and family. We need to live with this virus just like other viruses that have come before COVID-19. Just as of yesterday, and I watched this report, the CDC has reduced the number of days from 14 to 10 for quarantine. Interesting timing, in my opinion. So with other respiratory viruses going around, why this one? We did not do a shutdown in the world in the Hong Kong flu back in 1968 or the swine flu in 2008. So some of you are saying that you don't want to infect someone else. Well, there are no guarantees in this world. Tomorrow I could die from a freak accident. Perhaps you are wanting to keep someone that you love from getting sick. And of course, no one wants to make someone ill. But what about the other side of the coin? Let that person weigh the options. People all over the United States are living alone and dying alone because we are so concerned that we may make them ill. They may be alive for now, but what about next week, next month? You didn't see them, you didn't hug them, you didn't enjoy their company. You kept them alive, but they were alive on a shelf, so to speak. What about those regrets? We are looking at years for this, and I think longer if we try to prevent something that we cannot control. The longer we drag this out. For all of you scared people, stay at home yourself. Order your groceries in, but remember, somebody has to deliver those for you. Order from your Amazon account, stream all your movies, and hunker down. But as for me, I want to live my life and not be afraid.
30 seconds.
Okay. Think of all the firsts that people have missed and will never do again. All the proms, all the deaths of a loved one that people could not attend a funeral, weddings, or other major events. Think of what we missed in Papillion this past June. We missed our 150th anniversary of our town. We can't do that again. It's over. Tradition is tradition, and if people get lazy and don't continue it, next time or later becomes never. Well, I have a bunch of other stuff to cite, but I guess in the instance
And if you've
of
got it
time-
in writing and you want it part of the minutes, if you want to give it to us, we can take that as well.
Well, it's kind of sloppy,
Okay.
but I have things that
It doesn't
talk,
have to be formal.
I have things that talk about how masks make people sick. I can send those.
If you want to,
And studies.
because if this does pass, it's going to go on to city council, so we can make that part of the minutes as well.
Okay, because there are.
And just
one,
for a
two-
point of reference, we will
Okay.
again at city council have proponents and opponents, but just for sake of time, just so you can think of how to succinct it. At council, I will probably very strongly enforce the 3 or 5 minutes because I think we'll have a lot more people.
Okay,
I gave you about 7 minutes, so.
Okay.
Thank you
well,
very
I
much.
will email it then.
Email it to Nicole Brown,
Okay,
city clerk. Thank you
Okay.
very much.
you're welcome.
Do we have any other opponents? Anybody want to speak against? Anybody neutral? Yes, sir. Go ahead and come on up. And I'll do the same courtesy for 5 minutes. And if you'd state your name and address for the
Okay,
record.
Yes, thank you very much. My name is Justin Lucas. I live at 1105 Michelle Parkway. I've already emailed my thoughts and objection to the city clerk over here, but I'd also like to expand on that based off some of the things that I've heard here this morning. While I do definitely understand that the community has a vested interest in keeping one another safe, I also have a huge interest in respecting and protecting civil liberties as well. One of the things that I keep hearing is an urgency to comply from the medical community, and that concerns me to a degree, because at no point in conversation that I've heard both locally or nationally has anybody said, where do we draw the line? Today, we may create a mask mandate to protect against COVID-19. But what's going to be the next mandate that's put in place for the next virus? I think that that is a conversation that definitely needs to be had. And I think that an urgency on respecting people's civil liberties, their protections under the Constitution of Nebraska and the United States as well. One of the things that I heard mentioned this morning, you pointed out these the ground zero events, Thanksgiving, Christmas, New Year's, things like that. There may be a desire to cooperate initially from people as we get through the holiday season. But if the mask mandates continue past the holiday season, to me, it begs a question of how long are people going to continue passively complying? How long will it be until protests start erupting out? There's already been legal challenges to mask mandates, both at the state level, and I believe they've entertained the idea of going into the Supreme Court of the United States as well, that mask mandates violate the First Amendment of the U.S. Constitution. And while those sort of protections under those constitutional amendments may be waived temporarily in the interest of public safety, are the city willing to also waive protests as well, which is also protected under the Constitution? And if the community decides to protest mask mandates on a weekly basis, monthly basis, heaven forbid, even a daily basis, would that not create more ground zero events after the holiday season? So with all that in mind, I just wanted to speak out with all that to bring that to everybody's attention as well, and urge you to take that into consideration before we move forward, or before the city moves forward on voting for this. Thank you very much.
Thank you very much. Do we have any other opponents? Anybody neutral? Any council, any Board of Health discussion on the motion?
Mayor.
Mr. Stubbe.
Yeah, I just wanted to make a couple comments based on, and I thank everybody that came here this morning and the opponents that wanted to get up here and speak. I like the mayor, I got a number of emails relative to proponents or opponents with regard to mask mandate. One thing I do want to make a comment about, one of the opponents indicated about a shutdown, and this is not a shutdown. This is only a mask mandate. This has nothing to do with shutting down businesses. I support businesses. I want everybody to stay open. There's no question about it. We talk a little bit also about personal rights. We also have property rights, and that's part of the reason why I got into the discussion with the police chief relative to businesses that have a policy related to mandates for masks. That is a property right. They can do that, and they have the enforcement under the law to be able to enforce that. So I think that's an important point also to make, is that we have a lot of businesses out there that want to stay in business, and so they've interjected policies, and they need to also be protected. Thank you, Mayor.
Any other discussion? Seeing none, please vote.
Five yeas, 0 nays.
Motion passes. So then procedurally, well, not procedurally. So the Board of Health has passed a recommendation. Depending on how you read state law, it's more than a recommendation. It's actually enacting an ordinance. But according to our city laws now, the city council must basically affirm it or adopt it. The way ordinances work traditionally under state law, it should not be a fast process to sneak things through. It's a very open and transparent process. And so generally ordinances take 3 readings of the city council. We'll have one city council meeting where it's introduced. We'll wait till the next city council meeting 2 weeks later to have public discussion and input. We'll wait 2 more weeks to the 3rd city council meeting to have council discussion and a vote. And once it's approved, we wait 15 more days to enact it. So passing of an ordinance on a fast path is almost a 2-month process. State law does provide for 2 provisions, and that's what we need to give some council some direction on. They were already hinted at. One is council does have the authority to waive the 2nd and 3rd reading. They have to do it with a supermajority of the council, so it's not a simple thing to do. But I think it would be important for the council to understand the Board of Health's desire on that. And so what I think the first thing we're going to do is ask, is there a motion to recommend the city council waive second and third readings for ordinance 1911? A motion and a second and approval would suggest to the council to go ahead and do that and expedite this. A no vote or no motion would say follow the normal process. So I'll go ahead and ask, is there a motion to recommend the city council waive second and third readings? Motion by Councilman Bose, second by Dr. Strohmeyer. Any discussion on that? Please vote.
Four yeas, one nay by Stubbe.
Motion passes. So then the next question is, when the city council approves, whether it's on the expedited path or the normal path, because the council still has to vote on this waiver of second and third, but either way, if they do approve the ordinance, does the Board of Health recommend that it include an emergency clause, which says it pretty much takes effect immediately upon passing, or do we wait the 15 days? So is there a motion to recommend the city council enact an emergency clause relative to ordinance 1911? Motion by Dr. Strohmeyer. Second by Fire Chief Bose. Any discussion on that? Please vote.
Five yeas, zero nays.
Motion passes. Do we have a motion to adjourn? Motion by Councilman Stubbe. Do we have a second? Second by Dr. Strohmeyer. Please vote.
Five yeas, zero nays.
We are adjourned. Sarah, I just want to thank you for joining us virtually, giving us the information. And just for the public, our next city council meeting is our regular one this next Tuesday. This ordinance will be on that agenda, and the agenda item will be the first reading, so a council member to introduce. There's no public discussion on an introduction, but if they do vote to waive second and third, then we will have a public hearing and we'll allow the public discussion on that one. We are adjourned.